So let's talk about addictions that aren't drugs, right? Because that's a thing and people always want to talk about that. We call them the process addictions, right? They're processes or behaviors. They work in some ways very similarly to drugs and in some ways differently. The way they're most similar is that for these specific behaviors in certain individuals, they release higher than normal amounts of dopamine. So the amount of dopamine that's released when I go to the casino and gamble is different than somebody who goes to the casino and gambles and has a gambling addiction. They release massive amounts of dopamine, almost as much as drugs do for everybody else. And the difference, though, is that the process addictions are sort of individual. They're genetically based, but they're individual, so there's no crossover. So like with drug addiction, as I said earlier, if you're addicted to cocaine, you're also addicted to alcohol, even if you don't like alcohol, right? Using alcohol will still hurt your brain in the same way that using the cocaine will. But if you're addicted to gambling, you are not automatically addicted to drugs. You're not automatically addicted to sex and video games and exercise and all those things, right? That's just one specific behavior. And so there's no crossover there. So, but we do see it certainly with high levels of dopamine released from all different kinds of things. And a lot of times what happens is, let's say it's not even a primary diagnosis. Let's say a person gets addicted to alcohol, their threshold for pleasure is all the way up here. Then they stop drinking, but they're not really learning any skills to deal with life. And so while their threshold for pleasure is coming down, they feel depressed. They feel dysthymic. They can't get joy from anything, right? Because the normal threshold's all the way down here. So their grandkids can only give them pleasure down here, drugs up here. So now they're coming down. Well, this person, let's say, has a predilection, a genetic predisposition for gambling addiction. So they start going to the casino to fill their time, and they find that gambling actually makes them feel good, right? So it's releasing dopamine just across this. So what they do is they stop doing anything else, and that becomes their coping skill. And so the threshold pauses there because that's how many dopamine receptors are left. And so they continue to gamble. And eventually they run out of money, or they can't do it usually that's it, they run out of money. Or maybe their marriage ends or something because of their gambling, there's a consequence. And so what winds up happening is they stop, but their threshold for pleasure is still really high. And so because they haven't been spending any time developing new coping skills to deal with that dysthymia and depression and feeling like crap, they're gonna go back to drinking. And so that's really what we see a lot of times happening. The same thing with exercise. You know, there's nothing wrong with exercise. Exercise is very healthy. I strongly recommend it, but not for 8 hours a day, not to the point where you're not going to work, not to the point where your, gym memberships are taking all your rent money or whatever. So, I think it's a matter of, is it causing a problem in your life that then it becomes an addiction.